If you're over 60, this may surprise you. Some of the health checkups you've trusted for years could quietly start doing more harm than good after you turn 70. And the shocking part is, almost no one warns you about this. You've spent a lifetime doing the right thing, going to the doctor, following their advice, getting those regular tests just to be safe. So, hearing that certain checkups might actually increase your stress, lead to side effects, or push you toward unnecessary treatments can feel confusing. Maybe even a little unsettling. But please, stay with me for a moment. This isn't about creating fear. It's about giving you clarity, protection, and true peace of mind. As we age, our bodies change, our priorities change, and what once helped us may no longer serve us in the same way. See, after age 70, the goal of healthcare quietly shifts. It's no longer about aggressively chasing every number on a lab report. It's about preserving your comfort, your independence, and your quality of life. Yet, so many seniors are still placed on the exact same testing treadmill they were on at age 50. More scans, more procedures, more follow-ups. And with that, often comes more worry. Here's the part that most people, and even some doctors, don't fully realize. A medical test itself is rarely neutral. It isn't just a simple snapshot of information. It can trigger a cascade of events. It can lead to false alarms, finding something incidental that was never going to hurt you. This can lead to extra biopsies, which carry their own risks. And it can lead to new medications you didn't truly need, each with its own list of side effects. Each one of these steps adds a new layer of risk. It can cause fatigue, anxiety, and side effects that just seem to linger longer in older bodies. And sometimes, the real harm doesn't come from the disease that was being looked for. It comes from the chase itself. Now, let's be clear. Doctors mean well. Your family means well. But modern medicine is not one size fits all. And this is especially true after the age of 70. Many of these routine screening tests were originally designed for younger adults. They were based on studies of people with longer life expectancy windows and bodies that could bounce back faster from procedures. When these tests are applied automatically to everyone in their later years, without personalizing the approach, they can tip the delicate balance from helping to harming. This doesn't mean you should avoid doctors, and it absolutely does not mean you should ignore new or worrying symptoms. Not at all. It means something far more empowering. It means knowing which routine checkups deserve a second conversation with your doctor. It means understanding which tests may no longer offer a clear benefit that outweighs their potential harms. And it means learning how to protect yourself from a cycle of unnecessary interventions. Many seniors assume that declining a recommended test is reckless or irresponsible. But in reality, making an informed decision to hold back can be one of the wisest health choices you make. Because real prevention after 70 isn't just about doing more. It's about doing what truly matters for your well-being. In the next part of our conversation, we're going to calmly break this down. We'll do it in simple, everyday language, without confusing medical jargon and without any fear-mongering. I'll explain exactly why certain common checkups become questionable with age, and we'll look at the common mistakes that well-meaning older adults make without even realizing it. Most importantly, you'll learn how to think differently about your health in a way that supports your strength, your confidence, and your longevity. And stick around, because there's one routine test in particular that millions of seniors still get every year, even though, for many of them, it quietly causes far more harm than it does good. You won't want to miss it. Let's slow this down and make it very clear. Avoiding certain checkups after 70 does not mean avoiding care. It means understanding how aging changes the risk-benefit balance. Here's the simple truth. Many medical tests were designed with one main goal in mind: to find disease early enough to change long-term outcomes. But after 70, early detection does not always lead to better results. Sometimes it leads to unnecessary treatments, stress, or a reduced quality of life. This is where the problems begin. Let's talk about 5 types of checkups that often deserve extra caution and conversation after age 70. Not blanket refusal, just thoughtful reconsideration. First, frequent full-body imaging scans. CT scans or repeated advanced imaging are sometimes ordered just to check. In older adults, these scans often discover harmless, age-related changes, small spots, minor abnormalities, things that would never cause symptoms. But once they're found, they can't be unseen. This often leads to more tests, biopsies, or procedures, each with its own risks, especially for seniors who heal more slowly. The mistake many older adults make is assuming more imaging always means better care. In reality, it can mean more anxiety and unnecessary follow-ups. Second, aggressive cancer screenings with no symptoms. Certain screenings were designed for people expected to benefit many years down the road. After 70, especially with other health conditions, some screenings may not improve your lifespan or comfort. Yet they can still trigger invasive tests or treatments. The common mistake here is fear-based compliance, thinking, "I don't want to miss anything." But sometimes, finding something that would never affect your life can actually make life harder. Third, repeated cholesterol testing with rigid targets. Cholesterol changes naturally with age. Numbers that once mattered greatly at 50 may be less meaningful at 75. Chasing perfect lab values can lead to higher medication doses, side effects, muscle pain, or fatigue. Many seniors assume every abnormal number must be fixed. But after 70, how you feel often matters more than hitting youthful targets. Fourth, routine bone scans done too frequently. Bone health is important, yes, but repeating bone density tests too often rarely changes treatment decisions. What it can do is create worry or lead to medications that may not suit everyone. The mistake here is equating more testing with better prevention. Sometimes your strength, balance, and movement habits matter far more than repeated scans. And fifth, automatic annual checkups with no clear purpose. This may sound surprising. General checkups can be helpful, but only when they're personalized. When visits become box-checking exercises with long test lists and little discussion, seniors may leave with more confusion than clarity. The biggest mistake older adults make is staying silent. Not asking why a test is needed. Not asking what happens if they decline. Here's what all these have in common. The risk is not the test itself. The risk is what follows. False positives. Extra procedures. Treatments that affect your energy, balance, appetite, or sleep. After 70, the body doesn't bounce back the same way. Small disruptions can have big effects. This is why many geriatric specialists now focus on functional health instead of endless testing. Can you walk comfortably? Think clearly? Sleep well? Enjoy your day? Those outcomes matter deeply. And yet, many seniors feel pressured to say yes to everything because saying no feels irresponsible. In truth, informed choice is a sign of wisdom, not neglect. In the next part, we'll shift from what to question to what actually helps. I'll walk you through simple, realistic daily habits that protect your health after 70 far more reliably than extra tests. No extremes, no fads, just steady actions that support strength, confidence, and peace. So, what truly supports health after the age of 70? It's not complex programs or expensive treatments. Instead, it's the simple, medically safe habits that quietly protect your body every single day. These are the habits that many geriatric doctors value far more than repeated testing, because they improve how you function, how you feel, and how you live. Let's go through them step by step. Habit number 1 is to prioritize daily movement over formal exercise. After 70, consistent movement matters much more than intensity. You don't need long workouts or a gym membership. What you really need is consistent, gentle movement woven throughout your day. Step 1. Stand up at least once every 30 to 45 minutes, even just for a minute. Step 2. Include one short walk every day. 5 minutes is a great place to start. Step 3. Add simple balance movements. You can do this by standing near a chair for support, holding onto a counter, and just shifting your weight from one foot to the other. This simple habit protects your joints, circulation, digestion, and balance. It reduces stiffness and significantly lowers your risk of falling. A lot of seniors wait for motivation to strike, but it's much more effective to attach movement to your existing routine. Stand up and stretch after meals, after phone calls, or after watching the news. Movement is medicine, especially when it's gentle and regular. Habit number 2. Eat for strength, not for perfection. After 70, eating well isn't about following strict rules. It's about maintaining your muscle, your energy, and your stability. Step 1 is to include protein at every meal. This could be eggs, fish, yogurt, beans, or soft meats. Muscle loss or sarcopenia happens quietly as we age, and protein is your best defense to slow it down. Step 2. Don't skip meals. Even a light breakfast makes a huge difference. Skipping meals can increase feelings of weakness and dizziness in seniors. And step 3. Hydrate steadily. Take small sips of water throughout the day. Dehydration often disguises itself as fatigue, confusion, or even joint pain. This habit supports your strength more reliably than chasing perfect lab numbers. Habit number 3. Protect your sleep like it's a prescription. Sleep patterns do change with age, but its importance remains non-negotiable. Step 1 is to keep a consistent bedtime and wake-up time, even on weekends. Step 2. Reduce stimulation in the evening. Lower the lights, turn off the news, and try to avoid heavy discussions late at night. Step 3. Get some morning light exposure. Just sit near a window or step outside for a few minutes. Good sleep protects your memory, your mood, your immune function, and your balance. Many seniors underestimate just how much poor sleep affects their daily function. Yet, improving sleep often improves everything else. Habit number 4. Review your medications regularly, but do it slowly and carefully. This is one of the most critical habits after 70. Step 1. Keep an updated list of all your medications and be sure to include any supplements. Step 2. Review this list periodically with your doctor or pharmacist. Ask simple but important questions like, what is this for? Do I still need it? And, what side effects should I watch for? Step 3. Never ever stop taking a medication suddenly on your own. The goal isn't necessarily fewer medications at all costs. The goal is the right medications for you right now. This habit helps reduce side effects, dizziness, and harmful interactions, things that no test can fully prevent. Finally, habit number 5. Focus on function, not on fear. This habit really ties everything together. Each week, just quietly check in with yourself. Ask, can I rise from a chair easily? Am I steady when I turn around? Do I feel alert during the day? If you notice a change, then it's time to talk with your doctor. Not because of fear, but because of awareness. This mindset, if you remember only one thing from this message, let it be this. After 70, your health journey is not about catching up. It's about choosing wisely. You are not behind. You have not failed. And it is absolutely not too late to feel stronger, steadier, and more confident in your body. So many seniors carry this quiet guilt, thinking, I should have done more earlier, or I should be healthier by now. But that kind of thinking helps no one. Your body is still listening. It's still responding. It is still capable of incredible positive change. What changes with age is not your ability to improve. It's the strategy that works best for you. You see, a calmer, more mindful approach often brings much better results. Less panic, less chasing numbers on a chart, and more attention to how you actually feel each and every day. This is a big one. Choosing to question certain checkups is not denial. It's discernment. It's recognizing that your time, your energy, and your personal comfort matter deeply. Healthcare should support your life, not take it over. Think about it this way. If a test brings you clarity and genuinely helps you feel better, it has value. But if it only brings confusion, anxiety, or leads to a cascade of unnecessary procedures, it deserves a pause. You are absolutely allowed to ask your doctor, will this test or procedure help me live better right now? What happens if I decide to wait? Are there simpler, less invasive options? These are not difficult questions. They are wise ones. And believe me, good doctors welcome them. Your role is not to obey blindly. Your role is to partner thoughtfully in your own care. Small daily habits, a little bit of movement, good nourishment, proper rest, and just being aware of your body often do more to protect your independence than any high-tech scan or screening ever could. And when real concerns do arise, addressing them calmly and early, based on how you feel, not on fear, almost always leads to better outcomes. This approach does something incredibly powerful. It restores trust. Trust in your body. Trust in your own judgment. You stop feeling like health is something that's just happening to you, and it becomes something you actively guide and participate in. That sense of control is transformative. It reduces stress, and just reducing stress alone can improve your sleep, your digestion, and your energy levels. You don't need perfection. You just need consistency. You don't need to do everything. You just need to do what truly matters for you. If this message brought you some clarity today, let it stay with you. Maybe revisit it from time to time or share it with someone you care about. Because making informed, calm choices has a ripple effect. And please, remember this. Aging is not a medical emergency. It's a natural process that deserves respect, patience, and a whole lot of wisdom. When you care for your health with calm intention, rather than with fear, you give yourself the greatest gift of all, peace of mind. Thank you so much for spending this time with me. Take care of yourself, gently, thoughtfully, and confidently.